As a leadership board of the National Youth Sports Health and Safety Institute, it's important that we take a leadership role in the National Physical Activity Plan sports sector. South Dakota Junior Football, in partnership with Sanford Health, provides a blueprint for putting the tactics of Strategy 5 into action.
Inactivity is a national health problem, and we're hoping that we can use youth sports to try to intervene in that public health problem. We're here at the Sanford Sports Complex, where you can see in the background the football fields and games and the kids being active today. We're hoping to look at ways that we can make youth sports fun for everyone and get more people involved. We're trying to use the latest research techniques and public health interventions to try and keep kids active as much as possible. It's clear that kids who are active become active adults. And it's also clear that a lot of kids drop out of youth sports, often way too early. So we're hoping that if we can make this fun for them, they'll stay with it longer. We're trying to develop a system or a program that can be adopted nationally by any group. And we're hoping that the structure that we're developing through Sanford will help you make your program the best and the most competitive and safest for kids in your area.
South Dakota Junior Football is a youth instructional football program established in 1969. We're currently in our 52nd year of operating. We have about 2,000 kids annually that participate in the program. About 7 years ago, we started a flag program, which has about 700 kids in that program, which is pretty good for a relatively new program. Mainly, we focus on developing our youth in preparation for their high school years. Our focus is on working with the fundamentals of the game, obviously, but trying to keep the kids in a safe environment and also creating a positive attitude for the players that all participate.
The game of football has evolved over the last 20 and 30 years, and South Dakota Junior Football has evolved along the way. They've really put the health and safety of their players first and foremost. They've done that through coaching education and certification, through making sure that they've got proper equipment and that their fields are well maintained, that parents and athletes and coaches are educated on the rules of the game and how to properly play the game to minimize the risk of injury.
USA Football works with thousands of youth football leagues across the country. When we have the opportunity to recognize and applaud the efforts of a league like South Dakota Junior Football, who is setting policies and procedures that have the interest of the athletes at heart, we know that this is a league that is setting a standard that we want to have other leagues follow. By putting procedures in place that really have the best interests of the kids at heart, we know that leagues like South Dakota Junior Football are really setting a gold standard for leagues across the country. SDJF is setting a gold standard within the youth landscape, the youth football landscape, and that's very important to organizations like USA Football so that we have leagues that we can point to that are making these extra strides and going the extra mile in setting policies and procedures that are really not only going to focus on what's best for the athlete as a football player, but what is best for the athlete as a person. And by paying attention to these safety policies and by creating these types of environments that are safe not only physically but emotionally, we know that we're hitting the mark and we're setting a gold standard. So to recognize leagues like SDJF that are doing it this way really gives us a beacon that we can point to for other leagues to look at and learn from.
South Dakota Junior Football's relationship with Sanford Health started back probably about 25 years ago with implementing basically a bag program where Sanford would provide medical bags for all of our teams in our program. You know, the bags would consist of your basics, Band-Aids and tape and ACE wraps and a couple ice bags. And so we've been doing that for a long, long time. Over the years, it's obviously changed and enhanced our program to the standpoint where we have certified athletic trainers at all of our games that are provided by Sanford Health. And then also some programs that we've done with Sanford Research regarding concussion studies, baseline testing for all of our players, especially our older players, the 3rd and 4th, 5th and 6th graders, 7th and 8th graders. Over the years, the game of football has changed a lot, in particular with the media presence and the focus on injuries in the college and in particular the NFL. So, you know, a lot of parents are kind of hesitant. We believe there's kind of an attack on the game of football. Should the kids play? Shouldn't they play? So a lot of people have opinions on that. but there's no facts to back it up. So we've been proactive with our relationship, not only with Sanford, but also with USA Football. South Dakota Junior Football was a pilot program with USA Football in helping them develop their Heads Up program. We were one of 5 programs in the country that worked with USA Football to develop the Heads Up program that we all use today. We strive to make sure that our parents are aware that, for example, all of our coaches are Heads Up certified through USA Football. All of our coaches have to go through a background screening so that the parents know that their child is being put in a safe environment, both from the teachings that we do of the game of football, but also from the quality of the people that they're working with, in particular their coaches. Again, it's about the safety of the players, whether it be practicing or in games or just the people that they're around relating to South Dakota Junior Football.
Injury and illness can really hamper a child's experience within the game of football, or any sport for that matter. But when we want to have great participation rates, we want to have great retention rates and keep kids involved in our sport, part of that is keeping them out there on the field. Children sign up to play sports. They don't sign up to stand on the sideline. They don't sign up to be injured or not be out there with their friends. So making sure we have protocols in place to keep kids active and healthy, or on the back end, we have the right partnerships to make sure that we can provide athletic training services to get the kids back out in the field, keeps them involved in the game. Being involved in the game and with their friends is what leads to great experience. This contributes to players coming back to our great game, or at very least, having a positive outlook on physical activity and developing healthy lifestyles. Youth football can be seen as unique because of the protective equipment worn in our game. This gives leagues a unique challenge that some other sports might not face. With the standards in place by our partners as far as equipment fitting, equipment recertification, and standard of care for playable equipment, it is key for youth organizations to be really clued in to changing standards, what's new on the market, and what they need to do to make sure their equipment is up to date and in line to be certified available for play. When organizations take on these programs and they look at how we're going to refurbish and refit our equipment, how we're going to make sure it's reconditioned, making sure we're following equipment manufacturers' guidelines on rotating out helmets once they've meet their age restrictions, this is key because not only does it keep our players healthier and safer, but it also shows our parents that we are committed and everything we are doing is to make sure we provide the best experience for your youngster.
So South Dakota Junior Football's partnership with Sanford Health is a perfect example and model of a community partnership. We couldn't perform the research that we do on health and safety in youth football without a partner like South Dakota Junior Football. And to the same token, they couldn't provide the level of health and safety to their athletes without a medical partner like Sanford Health. So it's mutually beneficial. And when I like to tell people that these football fields are my laboratory, and they're literally right out the steps of my office. But we come out here, we work with the athletes, we work with the players, we collect novel data, we interpret it, we share the results, and we make the game better. What we've really seen is that I think it's a better experience overall for the players. I think parents are more comfortable signing their kids up to participate in this organization because they know the leaders, they know the board and the coaches have the health and safety of their players in mind. And it's not just talk, it's actions. It's steps that they've taken from the moment they sign up and from the education that the coaches are receiving when they go to equipment handout and they see that there's 20 board members there fitting them with equipment and they see that it's reconditioned, recertified equipment and they're getting good stuff for all of the teams. And there's athletic trainers on the fields and they know that if their athlete gets injured, they know who to call, they know where to go, they know that the league is taking care of them. They see researchers out in the field that are monitoring players and collecting data and doing things that aren't being done anywhere else in the U.S. And that's through a partnership with South Dakota Junior Football to really improve the game and make it healthier and safer for all players.
I would hope that most of the health organizations in our country would have a similar approach toward working with the youth organization as what Sanford has here in Sioux Falls, South Dakota, and the surrounding area. Having that relationship has just been great. It adds credibility to our program. It adds security to our program from a parent standpoint when we go out and talk to parents, especially in communities surrounding Sioux Falls, South Dakota, that are interested in joining our program and having their kids participate. They want to know, what are you doing to keep my son or my daughter safe And when we talk about all the things that we do through education, through USA Football, the certified athletic trainers through Sanford, the concussion study that we're doing with Sanford, baseline testing with Sanford, all the things that we do, it all adds to the credibility of the program and the safety that the parents see and the comfort level that they would have in allowing their kids to participate, not just in South Dakota Junior Football, but in the game of football, period.
I would say at these young ages, especially second grade football, I feel like it's the safest time to ever play the game. I mean, the speed and the physicality is just not there. They're learning the basics of it, having fun with the game. And I think, through the early ages, it's a safe time to play the game.
The remarkable thing about this organization is that it's led by volunteers. The coaches, the leadership board are all volunteers. So they don't have to take any of these steps. They could simply put rosters together and go out and play games. But they take the extra effort to make sure that they're putting the health and safety of their players first. And it really does take a coordinated effort on their part to be able to bring in these different steps and put them into action over the years. It didn't happen overnight. They've added the education pieces, they've added the fields, they've added the equipment procedures. Those have all been added over the years. They've put athletic trainers on site so that they could monitor injuries as they occur. That's something that never happened when I was playing. It wasn't even thought of. It wasn't even a part of the thinking process of how you would put together a youth program. So now things that are commonplace in this league are things that, again, 20 to 30 years ago, people weren't even thinking about. They didn't even realize they were important. And the same can be said for the concussion education and awareness and the research that they're partnering with Sanford Health to conduct so that we can learn more about health and safety in this game and make it better for future generations. Our institute would like to help your youth sports organization become as healthy and safe as possible and set yourself apart from the competition by following the guidelines outlined in the strategic plan of the sports sector of the National Physical Activity Plan. Youth sports is a great vehicle for physical activity and health, but you want to do it in a healthy and safe manner. And for a youth sport organization to really raise the level and provide all the things that are necessary to ensure that health and safety, it takes extra effort, it takes extra work. But at the end of the day, your program is going to be more sustainable and you're going to set yourself apart from the competition. Parents and athletes are going to want to come and be part of your organization because they know that you put the health and safety of your players first and foremost. So it is worth the effort. And when you put forth that effort, you're going to find that those actions you take are going to lead to a healthier and safer environment for your players.
We recognize that this program is not representative of all communities and circumstances. This program is unique in its location, players, coaches, and community partners. Although it may not incorporate another program's individual circumstances, this program serves as one example of how a sports organization can come together over time to create a healthy, supportive youth sports experience that will hopefully inspire their physical activity for a lifetime. The Sioux Falls football program also shows a way to fulfill the 4 tactics of Strategy 5 within the U.S. National Physical Activity Plan sports sector. Our hope is to inspire other youth sports organizations from diverse backgrounds and communities to create programs that work for their environment. Thank you.